diseases of the immune system, we are going to discuss immunodeficiency syndromes. Immunodeficiency syndromes are divided into primary and secondary. Primary are primarily genetic and hereditary, and they manifest between 2 years of life as maternal antibody production is lost. Secondary immunodeficiency syndromes are acquired and results from altered immune system that could be due to infections, immunosuppression, aging, malnutrition, certain chemotherapies, or autoimmunity. For example, AIDS. Classification. So it's as we have discussed, immunodeficiency syndromes are divided broadly into primary and secondary. Primary are genetically determined and present since early years of age, and they are less common. And secondary arise as a complication of certain cancers, infestations, certain viruses play their role, immunosuppression, radiation and chemotherapy that leads to secondary immunodeficiency syndromes, and they are more common. Primary immunodeficiencies, we are going to discuss them in detail, are basically a group of disorders characterized by an impaired ability to produce normal immune response. That is due to mutations in genes that are involved in development and function of immune organ cells and molecules, and it's genetically determined. And they present as diseases of infancy and early childhood. So children with repeated, often severe infections, and they present with cellular and humoral immunity problems and autoimmune defects. These diseases include Bruton, X-linked Agammaglobuinemia, common variable immunodeficiency, high IgA deficiency, hyper IgM syndrome, DiGeorge syndrome, SCID, severe combined immunodeficiency syndrome, with thrombocytopenia and eczema, with Scott-Eldrick syndrome, and other certain complement deficiencies. Now we are going to discuss them in detail. This flowchart shows the differentiation of stems into lymphoid cells, and the genetic defects that take place at the level of their differentiation that results in primary immunodeficiency syndrome diseases. As this pluripotent stem cell is differentiated into lymphoid stem cell, and it has to differentiate into pro-B cells and pro-T cells. When there is deficiency of adenosine deaminase deficiency, that results in that results in failure of these lymphoid stem cells to differentiate into pro-B and T cells. So there will be absent B and T lymphocyte response in the body. And when this pro-T cell is further differentiate into immature T cell, and if there is cytokine receptor chain deficiency, it results in failure of differentiation into immature T cells. So there will be no further differentiation of T lymphocytes, and cell mediated immunity will be defective. This results in X-linked severe combined immunodeficiency disease. If there is defect at the level of differentiation from immature T cell, which has TCR attached on its surface, to differentiate into CD4 and CD8 cytotoxic and helper mature T cells, and that defects results in DiGeorge syndrome. Now B cells, if there is a defect at the level of differentiation of pure B cell into immature B cell, in which it has immunoglobulins attached on its surface. It is as a result of Bruton tyrosine kinase gene deficiency that results in X-linked Agammaglobuinemia, and there will be no immunoglobulins and further differentiation of immunoglobulins in the body and a defective immune response against certain pathogens. Similarly, if there is CD40 ligand deficiency that results in hyper IgM syndrome, there will be no further differentiation into further immunoglobulin subtypes. Selective IgA deficiency results in IgA deficiency syndrome. There will be absence of IgA antibodies that lines the mucosal surfaces of the NGIT tract, and there will be defective response of the body against those sites. So where combines immunodeficiency syndrome. Synonyms of bubble boy disease and thymic A lymphoplasma is a genetic disorder that is characterized by absence of mature T lymphocytes. There is impaired both cellular and humoral response, and the patient will presents with certain defects in antigen presentation and functional immune molecules. Features of severe combined immunodeficiency syndromes. There are absent tonsils, small or absent lymph nodes, absent thymic shadow on X-ray, lymphopenias, so there is deficient T lymphocytes in the body, decreased number of T cells leads to severe Agammaglobuinemia, and no immunoglobulins are usually present. So without marrow transplantation, this disease is fatal. And also, it's a disease in which gene therapy to replace a defective gene in a stem cell has successfully applied. Bruton's X-linked Agammaglobuinemia. It's primarily the B cell defect, and boys are more effective. There is severe reduction in immunoglobulins in the body, usually, and the patients are susceptible to recurrent bacterial infections as there are decreased immunoglobulins and circulating and marrow mature B lymphocytes in the body. Basically, the killing of the bacteria as a result of opsonization usually takes place at the age of 6 months, and there is defective response against certain pathogens like bacteria, and that results in severe recurrent bacterial infections. Patient usually presents with consequently after that viral and fungal infections also, and it can cause fatal encephalitis. Probable cause is the molecular defect at XQ22 mutation of Bruton tyrosine kinase gene, and is normally expressed in early B cells. So there is reduction of signals from the antigen receptor complex that drive B cell maturation, and there is increased incidence of autoimmune connective tissue diseases, chronic infections, and there is breakdown in self-tolerance. Cell-mediated immune response is it's like okay in these patients, is normal in these patients, and therapy is basically immunoglobulins, replacement therapy with normal donor serum. DiGeorge syndrome. It's also called thymic hypoplasia. It's a congenital disorder and is characterized by abnormality in structures which are derived from third and fourth pharyngeal pouches. Characteristically, there is predominant T cell defect, cell-mediated immunity is cell defect, and B cells and immunoglobulins levels are normal in the body. Patient characteristically presents with neonatal tetany as a result of absence of parathyroid gland, and there is thymic hypoplasia or aplasia that results in T cell deficiency and lack of cell-mediated immune response. And there are certain congenital defects of heart and great vessels, and there are dysmorphic facies. Therapy is thymic transplant. This is the characteristic facial features of children with DiGeorge syndrome. They present with like cleft palate, anti-mongoloid eyes, short philtrum, fish mouth appearance, microganthia, low-set pixie-like ears, short palpebral fissures. Wiskott-Aldrich syndrome is an X-linked autosomal condition and is characterized by severe eczema, recurrent infections, bloody diarrhea, chronic otitis, and thrombocytopenia. Basically, there is defective T cell response and defective cell-mediated immunity as a result of mutation in gene Wiskott-Aldrich syndrome protein. Basically, this gene is involved in cell surface and intracellular cytoskeleton, and it may important for cell migration and signal transduction. So deficiency of that protein results in failure of recognition of T lymphocytes to certain polysaccharide antigens and proteins, and there is no antibody productions immunoglobulins against as a result of exposure to those antigens, and that results in certain bacterial infections. Platelets are decreased in number and small, and basically there is increased also incidence of non-Hodgkin's B cell lymphoma. This is the clinical picture in which the patient presents with eczema or skin rash all over the body. Histologically, peripheral blood film shows thrombocytopenia. Chronic granulomatous disease. It's basically a defect or inability of phagocytes to produce superoxide that results in ineffective reduction of oxygen. And there is failure to express respiratory bursts associated with phagocytosis. So there is defective phagocytosis, and that results in central necrosis and granulomatoid response in different organs like lung, liver, bone, skin, and lymph nodes. And on histologically, there are, or in peripheral blood film, there are numerous pigmented macrophages. Other primary immunodeficiency syndromes are selective IgA deficiency and common variable immunodeficiency. Selective IgA deficiency is a common immunodeficiency, and it's virtually there is absent serum IgA immunoglobulin in the body that results in defective mucosal response and as absent of IgA immunoglobulin in the body. Patients presents with gastrointestinal infections and recurrent sinopulmonary infections, and the treatment is the selective IgA immunoglobulin infusion, but that results in anaphylaxis. Common variable immunodeficiency syndrome is basically the absence of all classes of immunoglobulins, but primarily immunoglobulin IgG is absent, and there is defective B cell response as all classes of immunoglobulins are absent in the body, and it results in certain, and as a result there are certain recurrent infections, enterovirus infections, and persistent Giardia lamblia infections. And the patient presents with certain lymphoid malignancies, as well as there is increased incidence of certain autoimmune diseases as well as. complement protein deficiencies involves almost all proteins, or like 19 proteins are more commonly affected. Among them, 11 are classical, 3 alternate, and 5 regulatory complement proteins. Alteration in the expression of these proteins leads to certain autoimmune and immunodeficiency diseases. All 3 pathways are affected, like classical complement pathway. It is defective, results in certain, it affects the vessels and glomeruli. Alternative complement pathway proteins are affected and results in pyogenic or bacterial infections. And regulatory proteins deficiency results in hereditary angioneurotic anemia. Most common complement protein that is deficient is C2, and it results in no severe infections as the alternate complement pathway is unaffected. And like certain other proteins like C3 deficiency, it affects the both complement pathways, and there is increased susceptibility to certain infections. Defectives in certain, like if C5 to C8 complement components are defective, there is recurrent Neisseria infections. C1 esterase inhibitory protein deficiency results in hereditary angioedema, and deficiency of other complement regulatory proteins like TK accelerating factor results in paroxysmal nocturnal hemoglobinuria. Diagnosis of primary immunodeficiencies are primarily done on histopathology, immunohistochemistry, or monoclonal antibodies, or flow cytometry, or in situ hybridization.